Hello and welcome. Today, we're exploring the ever-evolving world of menopausal hormone therapy, or MHT, as many of us call it. Some of you have sent in some really interesting research, including an article from Climacteric titled Menopausal Hormone Therapy, A Better and Safer Future. Let's break it down and see what all of this means for women's health. Hi, I'm Dr. Pierre, a board-certified anesthesiologist and addiction medicine specialist. With extensive experience in the operating room and in both methadone and Suboxone clinics, I've dedicated my career to helping patients overcome the challenges of addiction and recovery. I also specialize in hormone replacement therapy, working closely with individuals to restore balance and improve their overall well-being. While this podcast is designed to share valuable information, it's important to consult your doctor for personalized medical advice that fits your unique health needs. The exciting thing about this field, the field of treating hormone imbalances, is that it keeps changing. We're always learning something new, which helps us make better, more informed decisions about women's health during this phase of life. One of the most intriguing ideas in the latest research is the concept of a critical window for starting MHT. This idea suggests that there is a 10-year period after menopause during which the benefits of MHT might actually outweigh the risks, especially for healthy women. It helps explain why some of the previous studies on MHT seemed contradictory. The timing of when MHT was started might have made all the difference. The concept is that starting MHT earlier might actually be protective. For example, one study highlighted in the article looked at women between the ages of 50 and 59 who started MHT early and found that they had lower mortality rates, meaning they were living longer. So, it's not just about managing symptoms. It might also be about improving long-term health. Now let's talk about the different ways to take estrogen. This is important because how you take estrogen, whether it's through a patch, cream, or a pill, can make a difference. The research gets into the differences between transdermal estrogen, which is absorbed through the skin, and oral estrogen. Using transdermal estrogen, like a patch, can reduce the risk of venous thromboembolism, or VTE, which is essentially a blood clot in a vein. This can be especially dangerous if it travels to the lungs, so minimizing that risk is really important. The article also talks about progesterone, which is a key part of MHT, especially for women who still have their uterus. Progesterone helps protect against certain risks that can come with taking estrogen alone, like endometrial hyperplasia, a thickening of the uterine lining that could increase the risk of cancer. There's been a lot of discussion around micronized progesterone, or MP, which is often seen as gentler on the system. However, the research on MP and breast cancer risk is mixed. Some studies suggest it might be safer, while others show a potential increase in risk with long-term use. It just emphasizes the importance of having a discussion with your doctor to determine the best course for you. Another interesting option for some women is using an IUD that releases levonorgestrel, often called an LNG IUD. These can be especially helpful during perimenopause or early postmenopause as they provide effective contraception and help reduce heavy bleeding. However, there is some emerging research suggesting a possible link between these IUDs and an increased risk of breast cancer, especially when combined with estrogen therapy. But, as with much in medicine, the studies have limitations, and more research is needed before drawing any firm conclusions. The bottom line is that MHT is not a one-size-fits-all treatment. It's really about finding what works best for your individual needs. This shift towards personalized MHT is crucial because everyone's body and health situation is different. The old approach of the lowest dose for the shortest time might not be right for everyone anymore. Now it's about figuring out the appropriate dose, the right duration, and the best way to take it for your unique circumstances. Looking ahead, the future of MHT seems promising, with ongoing research paving the way for more personalized and effective therapies. Imagine treatments that not only help manage symptoms, but also improve overall health and well-being. A symptom-free menopause might still be a distant goal, but we're certainly moving in the right direction. So, whether you're considering menopause hormone therapy, MHT, or are already on your journey, remember that the key to success is having open, honest conversations with your healthcare provider. Ask questions, share your concerns, and take an active role in your care. Menopause is a significant transition, but with the right guidance from a knowledgeable provider, it can also be a time of positive change and growth. For those of you in Oklahoma, Texas, South Carolina, and Florida, I'm here to support you directly with personalized care and expertise. If you're ready to take the next step, don't hesitate to reach out. Thanks for listening, and stay tuned as we continue exploring fascinating new topics together.